Nick, this has huge implications for the fight against the pandemic, that the J&J vaccine will now be made available here in the United States.
Absolutely, Wolf. This vaccine is key to the rollout because it's one shot and it does not require ultra cold storage. Now, this committee debated, heard presentations for nearly 6 hours. The only real point of contention was whether to say that women under 50 could be given the option of a different vaccine. They decided against that, saying that it was perhaps confusing or maybe impractical. The final vote was 10 votes in favor, 4 against, and 1 abstention. Looks like Johnson & Johnson's vaccine will soon be back in the game with a new warning label and patient instructions.
We recognize that there is a very rare but important and serious risk.
As of Wednesday, just 15 cases of a rare clotting syndrome confirmed among the nearly 8 million people given the J&J vaccine, all in women, most between the ages of 18 and 39.
There were 3 deaths, 7 remain hospitalized, 4 in intensive care.
One major benefit of this pause, the time to educate physicians on how to spot and treat clots.
I now have a different set of things to look for than I would have 2 weeks ago. It also changes how I treat clots if I find them.
These very rare clots are treatable.
Early presentation by education of public and physicians will improve outcomes.
The CDC director and the FDA still need to sign off on redeploying this vaccine.
I think the FDA and I both feel strongly, and the CDC feel strongly, that we need to act swiftly.
Because it's a great arrow to have in the COVID quelling quiver.
That may be uniquely good, and in some cases really the only practical option for some people.
And a longer pause might further fuel vaccine hesitancy. Some big names now on board to fight such fear.
It's something to be proud of, and I think as a nation, we are so close to being through this that I'm just trying to help get us there, because we got to get back on the road.
The average pace of vaccination just dipped back below 3 million shots a day for the first time in a couple of weeks.
While we know the next phase of the vaccination program will involve improving access, increasing confidence, ensuring equity, it won't be easy. But neither was getting to 200 million shots in arms in less than 100 days. But we did it.
So, when can more school-age kids get a shot?
I'm quite hopeful that even by May, that we would have a vaccine available for 12 and above.
Manufacturers also prepping for a possible need for booster shots for all.
We're working very hard to potentially have late summer, early fall, that boost for the variant.
Meantime, the average daily COVID-19 case count in the U.S. continues to fall.
When we continue to vaccinate all Americans, we will continue to see these numbers move in the right direction, but we cannot afford to let up.
Now, one of the other key messages out of this meeting today, the early symptoms of these possible clots, what to look for. The CDC says the symptoms can be a little vague. Headache might be the key. Now, not a headache the day after the vaccination. That can happen for benign reasons. But a headache a week or 2 after the vaccination, you should go to your physician and tell them that you have had the shot. Wolf?
All right, Nick, thanks very much. I want to bring in our chief White House correspondent, Caitlin Collins. Caitlin, major breaking news we're watching right now. What are you picking up over at the White House?
Well, I think the next question, as the White House is kind of watching all of this happen, they're not really involved in this decision because it's up to the CDC and the FDA now. This is a decision that goes to the CDC director, Dr. Walensky. She's going to make the next decision about whether or not they are going to follow this recommendation to resume the use of the Johnson & Johnson vaccine. But Wolf, what I can tell you that as they're waiting on the CDC to make that decision, that the White House is kind of ready to go for this because they do have 9 million doses of the Johnson & Johnson shot that have already been distributed to states and those tribes and territories and even those federal channels that the White House has recently been using to also get people vaccinated. And so if the CDC does move forward with approving this recommendation that they got from this outside advisory panel, Wolf, that could potentially mean that as soon as tomorrow you are seeing people start to get vaccinated with Johnson & Johnson and see it resume being available in all 50 states, because of course these are the states that as soon as the federal government had recommended that they stop using Johnson & Johnson a few weeks ago, all 50 states followed suit. And the White House, of course, that kind of sent them into a scramble as they were talking to governors about why this was happening, what they believed the next steps were going to be, because there is a bit of a separation between the policy aides here at the White House, those who are working on ramping up vaccinations, and the decisions of the FDA and the CDC. They've really worked hard to try to keep that separate because, of course, there were concerns about that during the Trump administration. So I think that's what you can look for next. And, of course, the big question is, how does this affect what you're seeing with these daily vaccination numbers and the next big thing that the White House is working to combat, which is vaccine hesitancy?
Yeah, good point indeed. I know they're watching this so closely over at the White House. Caitlin, thank you very much. Let's get some more on the breaking news right now. Our chief medical correspondent, Dr. Sanjay Gupta, is with us. Also with us, Dr. Lena Wen, a CNN medical analyst, the emergency room physician, former Baltimore City Health Commissioner. Sanjay, you've been monitoring this very, very closely, the CDC Advisory Board meeting. What do you make of this decision just announced to recommend the resumption of the Johnson & Johnson single-dose vaccine? Hold, Sanjay, hold on for a
Wolf,
moment.
can you hear me?
We lost your audio for a moment.
Okay.
All right, now we hear you.
Wolf,
Go ahead.
I think you can hear. I think that it seems like the decision, this was something that, they obviously gave this a lot of consideration. 10 people voted to lift the pause, 4 people voted not. They wanted more specific language. One person abstained from the vote, so there was 15 votes total. The abstention was because the person was involved with the clinical trial, so had a conflict. But this sort of makes sense, Wolf. I mean, they gave this a lot of review here. If anything, maybe people thought it was taking a little too long to come to this decision. But what we're hearing is that the pause they're recommending this. This is an advisory committee, but it's likely to become the final decision to lift the pause and to have a warning specifically about the possible rare occurrence of these blood clots, sending a message mostly to women under the age of 50 that in the rare chance they develop some symptoms that are associated with these blood clots, headache, blurred vision. As Nick Watts said, these are symptoms that typically occur a week or so after the vaccine, not right away. Then they should talk to their healthcare provider about that. And it was also a message to healthcare providers that some of these clots are very specific clots that need to be treated in a specific way. So getting specialists involved, hematologists, for example. That was, I think, what we sort of thought was going to happen. It sounds like that's what's going to play out. We'll get the final word from Rochelle Walensky at the CDC and then the FDA. And then 9 million shots, Wolf, are standing by potentially to go out, we hear.
They've already given nearly 7 million shots, Sanjay. So just tell our viewers how rare these blood clots in the brain have been. We're talking, 16, 17 cases out of nearly 7 million?
Right. Let me show you this graph. We put the numbers together here, I think, to understand specifically how many people actually developed this problem and then what the denominator was specifically, how many people within that age group received the vaccine. If you look at it, I think we can put up the graphic. Under the age of 50, basically, maybe a little bit hard to read there, but it was 13 people who actually developed this problem. You could see that that's on the left side of the graph. Versus, the number of lives saved, the number of people who hospitalizations prevented, you can get an idea of how they sort of assess the risk versus the benefit. It's very clear that the benefit, even if you account for this rare occurrence of these blood clots, the benefit is very much there just looking at the numbers. If you go to women over the age of 50, it's even clearer. There's clear benefit from this vaccine in terms of preventing hospitalization, preventing death. Remember, Wolf, for an emergency use authorization, what they ultimately have to show is that the benefits outweigh the risks. That was clear, and that's why it's really no surprise that they've lifted this pause.
Yeah, that's the recommendation. Dr. Wen, you're a physician, but you're also someone who actually received the Johnson & Johnson vaccine. So what's your reaction to this recommendation?
Well, I am glad that the pause is lifted, and I'm glad that they finally lifted it because there was a real cost to inaction. There were a lot of people who could have received the Johnson & Johnson vaccine in the meantime who didn't have the opportunity to. So I'm glad that this pause was lifted. But I actually agree with the 4 people who dissented with the vote. because I think that there should have been a stronger warning specifically for women under the age of 50. In this case, all these events occurred in women. And most of the events occurred in younger women. And so in the US, we are so blessed to have two other very effective vaccines, the Pfizer and Moderna vaccines. I think there should be a stronger warning for women under the age of 50 to recommend that they take one of these other vaccines instead that don't have this particular problem. Part of informed consent is presenting the risks, the benefits, and the alternatives. For people who don't have alternatives, if you're in a country where Johnson & Johnson is your only option, or if for whatever reason you prefer the one-dose vaccine, and there are real advantages to having the one-dose vaccine. Maybe some people have needle phobia. They don't want to come back for a second appointment. They should have the option to choose that Johnson & Johnson vaccine, even if they are a woman under the age of 50. But I also think that having the stronger warning, because these are not run-of-the-mill blood clots. These are really serious blood clots that could be fatal. And I think a stronger warning was indicated.